So it sounds like a lot of this might be occurring because there are different norms in some communities and some populations. Like you were saying, when the mother was like, well, that's not a big deal.
Right.
I wonder if you are able to better overcome those hurdles than a, white male physician, for example. If somebody like me came in there and told them that, they'd probably brush me off. But someone from the community, like you were saying, is able to connect, and they might listen more closely because they understand you better. They're like, oh no, she understands me. And have you seen that? Have you felt that kind of experience?
I felt that, especially when it came to birth control. So when we talked to them about pregnancy spacing, let's say they're on their 6th pregnancy, and we're talking to them about birth control, they read everything on Facebook or social media, and so they believe that as law. Social media is law, and grandma is law. Those two people are law.
Yeah.
So if grandma says, or something that they read says, they typically believe that. But when you can come in and you part of it is sharing your own experience, like you, not to the point you get too personal, but it's almost like a give and take. You have to be realistic. You have to be not so high above them, but put yourself on their level. So it's almost like sympathy and empathy. You have to feel with them. And when they know that you care, then they listen. They don't care how much you know. They don't, you could be the doctor so-and-so. They don't care how much you know. They want to know how much you care. And once you go in and you care with them and you help them to understand, I really want this for you, and I want you to want it for yourself, and help them set those goals and help them see themselves reaching those goals, then you're making an impact. Then their grandma who's in the house see that their child is changing, and grandma is now like, baby, she did take her prenatal vitamins today. So grandma is excited. And so now grandma is reinforcing what we're bringing into the home. And grandma is getting on the phone because, the phone still works.
Right.
This lady came to my house and she talked to my granddaughter. And now, it's helping to spread, the trust, and it's helping them to, by the word of mouth. Well, ain't your grandbaby pregnant? You need to call that program. I don't know. They might mix the name up and mix your name up. They may call you, oh, that's nurse, or they'll call you whatever they think they want to call you. But community health workers really do make a difference in that, not just for that person, but you're affecting that family, and that family is affecting the community.
Right. So it's